All right, folks, it's 12:30. Doctors Atwell and Reimer are with us. Please proceed.
Good afternoon. I'm Dr. Jaz Otwell. I'm the Deputy Chief Provincial Public Health Officer for Manitoba. We are continuing to see increased daily COVID-19 case numbers. Today, we are reporting 1,790 new positive cases, outbreaks at numerous locations, and even more deaths related to this virus. With most of our cases now likely the more contagious Omicron variant, we are seeing that the increased spread has meant for our pandemic response. We have to adapt and shift, and that is exactly what we are doing. And that's something we've done since the start of the pandemic, but the pace continues to accelerate. Yesterday, we announced that schools will move to remote learning for most students for the week of January 10. We know that school is the best place for kids, so this isn't a decision that was made lightly. But we need that time to ensure that everyone can return to school safely. Today, I'm also announcing a new change to testing protocols at our provincial test sites that is beginning to be implemented today. Generally speaking, most people aged 5 and up who have COVID symptoms will now receive a rapid antigen test, not a PCR test. People who test positive on a rapid antigen test should consider themselves as having COVID and take all the necessary precautions that we've set out, like notifying your close contacts and following self-isolation rules. Except in very specific circumstances, people who test positive with a rapid test will not have to get a PCR test to confirm their COVID-19 test result. This is to preserve our laboratory testing capacity. However, there are times when we still want the greater certainty of a PCR test for people who have a positive rapid antigen test. That's listed on our testing website now in more detail, but generally that is setting-based. So for healthcare workers or people who provide direct care in a long-term care facility, as an example. Testing sites are going to continue to use PCR tests for people who might be at higher risk of more severe illness or where the greater certainty of PCR testing is needed. That could include kids who can't do the rapid test at home, people who are immune compromised, if you've been outside of Canada in the last 14 days, if you're a person who's unsheltered, if you're having surgery, or if you're connected to an outbreak in a high-risk setting. The staff at this testing site will determine which test is right for you based on these criteria. Given the spread of the virus, it's not unexpected that we continue to see significant demand for testing. As a result, we are still encouraging younger, healthy people who have symptoms to assume they have COVID-19 rather than go for testing. We urge you to stay home to avoid spreading the virus. There are about 6,800 COVID tests that still need to be processed. This means we are underreporting the spread of the virus across the province. We're putting some additional capacity in place to clear these tests, so you can expect to see even higher case counts in the days to come as those are dealt with. And while there has been a lot of changes in the recent days and weeks, the fundamentals stay the same. Stay home as much as possible, reduce your contacts. If you're not feeling well, even if your symptoms are mild, stay at home. This is how we can reduce the spread of the virus. Another thing we can do is wear a well-fitting mask. There are many options available, but no matter which you wear, the fit is key so that there are no gaps around the outside of the mask. For the most people, in most settings, a double-layered cotton mask is sufficient, ideally with a filter layer between the layers. To wrap things up, we know that things are changing rapidly, and to all of the Manitobans who are doing their best to keep up and keep doing the right thing. Thank you. It's hard, it can be frustrating, and we know sometimes confusing, but we also know that you're all doing these things for the same reason. We are in public health doing them. You're helping to keep each other healthy, to keep people out of hospital, and to keep people safe. Together, we're doing this to save lives, even though it is hard. Thank you for that. I will now turn things over to Dr. Reimer.
Good afternoon. Thank you, Dr. Atwell. I'm Dr. Joss Reimer, the medical lead on the province's vaccine task force. I just want to first say that I hope everyone had an opportunity to get some rest and refreshment over the holidays. Certainly, I know this has been another stressful holiday season for many people. But I am so thankful to all of you who made time to receive your vaccines, including your booster doses over the holidays. Some of you made arrangements for your kids and for youth, or to support others who needed a little extra help to make appointments or to get to the clinics. We're still making progress every day, and that's thanks to all of you who continue to go for these appointments. But what we're seeing right now in terms of numbers related to the Omicron variant is still very concerning. I want to highlight a few facts to reassure you that the vaccine is still effective and is still keeping Manitobans in the hospital and out of the intensive care units. As of today, there are 252 people in Manitoba hospitals, with 30 of them in Manitoba ICUs due to COVID. So far, Manitoba is seeing that people who are not fully vaccinated remain more than 20 times more likely to end up in the ICU compared to someone who is vaccinated. While we know that Omicron is highly transmissible, as is being seen around the world, most people who contract this variant and who are fully vaccinated and especially boosted will experience significantly less severe COVID symptoms and outcomes. Those who are fully vaccinated and boosted are definitely the best protected among us. So if you do worry about the vaccine not working with this variant because our numbers are rising so quickly, I really want everyone to think about what the numbers might look like in Manitoba overall, and what our hospitalization numbers might look like if we didn't have such a high rate of vaccine uptake that we have in this province. There is still a very good news story to tell about the effectiveness of the vaccine in saving lives. So it is still protecting our communities from further restrictions and, more importantly, from loss. It is still giving us something to look forward to and to contribute to getting us out of this pandemic. A further breakdown of the results that we have is that 2 doses of the vaccine is not protecting against infection with Omicron nearly as much as we had hoped, or as much as we've seen with previous variants. But as I've said before, the mRNA vaccines remain effective at preventing hospitalization and ICU admissions. Multiple studies from Ontario, England, South Africa have shown that Moderna and Pfizer still provide great protection against Omicron hospitalization and ICU admission. It varies from 70 to over 95%, depending on which study we're looking at. There is more good news. Omicron is less likely to cause severe disease than Delta. Studies from Ontario, England, Scotland, and South Africa all showed that hospital admissions were lower, between 40 to 80% lower with Omicron, even after they accounted for differences in the number of vaccinated people. And some of these studies also looked at the length of stay and found that those people who did end up in hospital stayed for shorter time. South Africa reported that 2 doses of the vaccine only had 33% effectiveness at preventing Omicron infection. So this is where we see some of the bad news. In Ontario, this has been even lower. So this means there are a lot more people who are at risk of getting the infections, even if they may be protected against severe outcomes. With the number of infections being so high, even though it is a less severe variant, we're still going to see too many hospitalizations. But before I move to another topic, I will highlight one more time that the booster works, most importantly, to prevent severe outcomes. So if you are over the age of 50, or you have health conditions that put you at risk of severe outcomes, please get your 3rd dose as soon as possible. We want you to be protected. We want the healthcare system to be protected. And we want to see as many Manitobans experiencing that protection as possible. There are 5 different antibody studies that have shown that the booster greatly increased the number of antibodies in the blood that could effectively neutralize the Omicron variant. In the real world, Scotland and Denmark found that getting a booster increased your protection by 55 to 57% compared to someone with 2 doses. England also looked at the effectiveness of the booster against Omicron and found that vaccine effectiveness was 77% compared to someone who's unvaccinated. Something we haven't talked much about, though, is the fact that scientists don't yet know how long the booster will protect us. We need to gather longer-term data to know more, and we will share that with Manitobans as soon as we have that information. Obviously, we're hoping it will protect us for a long time, but with this new variant, we just don't know yet. The good news is that the vaccine companies are working on Omicron-specific versions of the vaccine, and there will hopefully be some good early treatment options available in Canada soon. But for now, even if the protection is shorter term than we would like, the booster is still the best way to protect yourself. So it's been a week since I gave an update on the use of Moderna over Pfizer for Manitobans who are over the age of 30. The reason for this shift is quite simply that we don't have enough Pfizer and will not be receiving enough Pfizer from the federal government to give everyone a Pfizer booster when they need it. If you are 30 or older, both Pfizer and Moderna are safe for you. If you are under 30, both options are also safe for you, but Pfizer is the preferred choice by the National Advisory Committee on Immunization. So I just want to take a moment to review why it's the preferred choice. A small number of young men experienced myocarditis after receiving a messenger RNA vaccine. Vaccine-related myocarditis is a rare, temporary, mild, and treatable swelling of heart tissues. For both vaccines, getting the vaccine is still far safer than risking a COVID infection. But when we have 2 options available, Pfizer is preferred for young people. This is because while myocarditis was already a rare and mild condition with Moderna, it was even more rare with Pfizer. The good news for people over 30 is that they did not experience the same increased risk of myocarditis regardless of which product they received. So all that said, to protect the remaining Pfizer doses, people who are 30 and older will need to get Moderna. People who are over 30 who already received a Pfizer booster should not be worried. We have no clinical concerns around the Pfizer booster. Normally, we want people to receive the same mRNA product for all of their doses because we simply have more data supporting sticking with the same product. But there's no data saying that mixing doses is a problem. What we do know is that delaying a dose definitely puts you at increased risk of contracting COVID-19 and of experiencing severe outcomes. So the bottom line is that these are both great vaccines. As someone who reads and analyzes the data all day and is over 30, I would be happy and confident to get either. So we're asking Manitobans to save Pfizer for the younger folks. I just want to thank everyone in Manitoba for your flexibility and understanding this minor shift. And we ask that when you do come to the vaccine clinics to get your next dose, that you are patient and kind with the staff who are doing their absolute best to communicate this public health information with you to protect you and protect all Manitobans. Before we move to questions, I just wanted to address something that I've been hearing quite frequently in the last few days. I'm seeing questions about when people should get a second dose for their kids age 5 to 11. At this time, the National Advisory Committee on Immunization continues to recommend an 8-week interval between dose 1 and dose 2. They reviewed this recommendation in the setting of Omicron and continued to recommend waiting 8 weeks because it provides the safest and most effective immune response. However, as kids go back to school, many parents are wondering if we should give the second dose earlier. Our Provincial Pediatric Medical Advisory Committee has so far also recommended the 8-week interval. But given the rapid increase in numbers, we have asked them to meet again this week to reassess this recommendation and ensure that we are up to date with the current situation. So if there are any changes, I will let you know next week. For now, if you have a particular reason why you feel your child should be vaccinated sooner, please discuss this with your family doctor or your pediatrician. And we can now go to questions.
Thank you, Dr. Reimer, and thank you, Dr. Atwell. A reminder to our reporters on this session, you will have one preliminary and one follow-up question to begin. Up first this afternoon from the Brandon Sun, Karen.
Well, good afternoon, everybody. Thanks for this meeting. I just wanted to know, at what point will hospitals be considered overwhelmed? We're already pretty, they're already pretty full. We're already over capacity for ICU. And a lot of people are asking us like, why we don't meet a lot of criteria for code red, so why aren't we there now?
So the acute care system is planning on how to manage and have been planning on how to manage COVID cases, and they already are doing that. And with the increased hospitalizations, they are managing. Shared Health would be best able to answer that question because there is a lot more planning going on that is outside of the realm of public health. So that question should be directed to Shared Health.
Okay, thanks for that. And this is more for Dr. Reimer. Of course, we keep talking about vaccines, but it seems that for the last little while, we're stuck at 20% of the eligible population is unvaccinated. And, and we keep saying, get the vaccine, get the vaccine. A lot of people are beginning to wonder if they're ever going to get that vaccine. So are there any other options at this point to either encourage them or somehow work around this?
Well, what I would first say is that this has been the most successful vaccination campaign in Manitoba's history. The fact that we've gotten close to 80% of all Manitobans to receive the vaccine is remarkable, and I'm so thankful to everyone who has stepped up to receive a dose. We know we're never going to reach all Manitobans, and so our goal has never been 100%. But we'll continue to provide consistent messages to people. We'll continue to make sure that they have access to information, and we'll continue with all of the existing structures that are in place to encourage vaccination and make sure that it's easy for people to get it. And we can't convince everybody. But what we can do is make sure that everybody has access to the information that they need to make the decision and then easy access to the vaccine.
Okay, thank you.
From CJOB, Will.
Hey, good afternoon to you both. Federal government is saying 140 million rapid tests are going to be distributed across Canada in the month of January. Do we know yet how many are coming to Manitoba and where they're going to be put to use?
So we just heard that this morning as well. I don't have an allocation number for Manitoba. When that's available, we will provide that. We talked about a testing strategy today, and that was based upon what we knew was happening and what we had in supply at the present time. So we're thankful for the additional tests that are coming, and we'll be looking to utilize them in the most appropriate fashion for Manitobans as well. And once we have further information on that, we will provide that to everyone.
Okay, thank you very much. I'd also like to ask about rates of kids going into hospital, especially with the rise of Omicron. Are we seeing any changes in the ratio of children being admitted to hospital?
Well, we know our hospitalization number of COVID clients is increasing, but that data isn't very pure, meaning some people are being admitted to hospital. Let's say someone had a traumatic injury, they broke an arm, they needed a surgery done right away, they would get tested and they would test positive for COVID. That would count as a COVID hospitalization, but the real reason they were in hospital was for a surgery that was required. So our hospitalization numbers are higher because of that. Also, maybe there is some Omicron or some COVID cases being hospitalized as well. So we don't have a firm number there. We know that number is increasing. So we're going to be teasing that information out. So work is being done as we speak to differentiate that hospitalization number to make sure that we're counting those who are being admitted for COVID in that number as well. On the pediatric side, we have had some hospitalizations related to COVID. We haven't, to the best of my knowledge at this point, it's been related to Omicron. We had some cases related to the Delta variant. But again, we are monitoring that situation, and we're going to continue to monitor that situation going forward.
Thank you.
From the Winnipeg Sun, James.
Good afternoon, doctors. I'm just for clarification, has the province made a decision about the severity of illness created by this new variant?
So the data is still coming in. We're still analyzing that data. Other jurisdictions are further ahead of us, and it's still too early to tell what that severity is. Early studies have shown decreased severity. Some studies have shown 50%, some at 75%, and some have shown not much change at all compared to, let's say, the Delta variant. There's a lot of confounding variables here, and we're still trying to get really good information to look at that risk in a population that is similar to ours and try to eliminate those other variables that might be impacting an accurate assessment on how severe Omicron is. We know there'll be hospitalizations related to Omicron. We think it is less severe than Delta, and there's numbers out there and studies out there that show 50 or 75% in some studies, but it's not clear cut if it's going to remain that way. And over the next few days and week or two, we'll have better information in relation to severity of Omicron.
Thanks very much. That's it for me.
From CBC Radio Canada, Mohammed.
Hello, Dr. Atwell. I hope you can hear me well. I want just a clarification on rapid test. How is it going to work? So people are going to testing sites, getting rapid tests to home, or are they going to be tested rapidly on site? Can you clarify that for me, please?
So if you go to a testing site and you have symptoms of COVID-19, the workers there will go through a criteria sheet to determine an algorithm on who is required to have a rapid test or who gets that PCR test. So there's a number of questions there. There's a number of variables related to that, and that is available online, those questions. And going through that process, if someone doesn't qualify for a PCR test, which most people won't, then they would be given a rapid test to take home. And instructions will be given with that as well, and what to do if the test is positive. Coupled with that, if there are people who qualify for what's called monoclonal antibody treatment, so there is a treatment that's available for people who have COVID-19, who have, let's say, are 18 plus, that have underlying significant health conditions such as immune suppression or organ transplant, and those who are 18 plus who have another underlying chronic illness, or those 40 plus without an underlying chronic illness if they're unvaccinated, that they may be able to qualify to get a monoclonal antibody treatment, which has been shown to reduce the risk of hospitalization, reduce the risk of an ICU bed use, and reduce the risk of a death as well. So it prevents severe outcomes. So that information is provided to individuals as well, and then they are instructed on how to use the test, and if it's positive, what to do, and if they do qualify for treatment as well, what to do as the next step.
Thank you very much. I was also wondering, how is Manitoba doing with the Delta variant? Are we still seeing hospitalization because of the Delta variant here in Manitoba? And do you have a proportion of whether it's Omicron or Delta now in hospital in Manitoba?
So Delta is still circulating in Manitoba. At a provincial level, most of our cases are Omicron, and it has been this way for over a week now, maybe close to 2 weeks, because most individuals live in the WRHA. Regionally speaking, the WRHA, Interlake, Eastern, and Prairie Mountain Health, the vast majority of those cases are Omicron as well. We haven't seen Omicron in the NRHA or in First Nations communities as of yet. So they're predominantly Delta. In Southern Health as well, it's predominantly Delta at this point, although the numbers are shifting. We still have Delta within the WRHA, don't get me wrong, we still have it, but the vast majority of cases are Omicron. Our most recent hospitalizations or ICU stays seem to be the Delta variant, but there's a number of individuals we still don't know if it's a Delta variant or an Omicron variant, and work is being done, especially on the ICU side, to determine the number of individuals with Omicron in the ICU versus Delta in the ICU, and we're hoping to get some preliminary numbers in the near future as well.
Thank you.
From CBC Manitoba, Ian.
Good afternoon. Dr. Atwell, on PCR testing, will there be some way for the province to record positive tests on the rapid test results, or are we effectively no longer going to be tallying in a proper way how many positive tests there are? And frankly, like, what percentage of cases that are out there do we think Manitoba is counting at this point?
So, I mean, at the present time, what we're reporting on is our PCR tests. The rapid antigen tests, we are providing those to individuals. They do take those home and do that test. And some individuals do come back for a PCR, so we would capture those. On those others, we don't capture a rapid antigen positive into our analytical system. We haven't done that at this point. And I think there's going to be a shift here, and we're already shifting in how we manage COVID-19. COVID-19 is there, it's out there, there's lots of cases out there, and there's lots of cases we don't know about. Historically, with the previous variant, with Delta, we knew for every case we identified, we missed out on 4. With this Omicron variant, likely for every case we identify, we're missing out maybe 8, maybe 10 cases as well. So from a rapid antigen test positive, we don't know how many positives are there. But we're still asking individuals to come in for testing, and specifically for PCR testing in certain situations. And also, we're going to continue to analyze and assess the situation to see if we can get some better numbers on rapid antigen positives that don't go for PCR, but that'll be much more difficult. But I think from a public health perspective, and this is about cases, don't get me wrong, but because of the sheer number of cases, this is more about the impacts on the acute care system. So a lot more focus will be done on the acute care system and hospitalizations and ICU use. And obviously that's a lagging indicator in case generation. So we are analyzing as much data as we can for that predictor.
Thank you. And Dr. Reimer, you had mentioned earlier that a team is meeting again this week to look into the duration of doses for kids, that second dose. You're telling parents to talk to their doctors. Is there guidance, though, being given to doctors, to pharmacies, that if they choose, that they can give certain kids a second dose earlier than that 8-week interval? Is there being some guidance being prepared for those medical professionals?
So we do have clinical guidance and a clinical guidance document available for all of our immunizers, including physicians and pharmacists. And that is something that we update regularly as new information comes in. The recommendation right now is for children to have that 8-week interval between dose 1 and dose 2. We do know that there may be some unique circumstances where physicians may need to do an assessment of the individual in front of them and make that individual decision around the needs of that person. And that's really what they're trained to do as family doctors, pediatricians, and other specialists. We know that they need to do these individual assessments as part of their care for everybody at every visit. But overall, our recommendation right now remains the 8-week interval, because we know that it provides a higher immune response, as well as the potential for lower risk of side effects for younger children. But we do want the Pediatric Medical Advisory Committee to take a look at what's happening with Omicron, take a look at what we're seeing in hospitalizations for children, and make sure that the benefit of waiting continues to be higher than the benefit that kids might get from an earlier boost to their immune response. And if something changes, then we will let Manitobans know right away that that our advisory committee feels that the balance of risks and benefits have shifted.
From the Canadian Press, Steve.
Oh, hi there. Since we're making the transition now to relying vastly on the rapid antigen tests and not the PCR tests, is the province going to make those tests more widely available? Some other provinces are distributing them at libraries and sending them home with school kids. And in Manitoba, it still looks like for the most part, we're going to have to line up at a PCR testing site, go through a quiz, and after some indeterminate length of time to get to that quiz, be sent home with a rapid test?
So that's a great question. So last week we handed out 500,000 rapid tests. The plan we have and the planning we've been doing with rapid tests has to do with how much supply we have. So we can't give out tests all over the place because we would run out of tests, which happen in other jurisdictions. So from a planning perspective, we looked at our supply, we looked at where rapid tests would be best utilized, and that's how we've operationalized them. Now with another supply coming in, we have to see exactly what that means, how many tests are coming in on a weekly basis and how much of a guarantee is that over the next, 4 to 6 weeks time as well. And we'll come up with a plan for that as well. So we do anticipate another 500,000 tests going out this week as well and next week. So again, rapid tests are out there, but we have to utilize them in a proper fashion to get the most value out of those tests as well. So again, we're going to continue to work on that strategy. This announcement helps us to try to expand the access and use of these tests as well. And again, once that information is finalized, we will provide greater information to the public on that.
Thanks. And while early data suggests the outcomes of the Omicron variant are less severe, it also suggests it's spreading, and you've said this, much more widely. And today we've learned that the Winnipeg Police Service has about 170 people booked off on COVID-related leave, and they're scrambling to fill some spots now. Given the widespread transmission of this variant and the fact that people still have to miss work in all sorts of sectors when they test positive, is the province considering a move to code red to stop the chain of transmission? So
our orders right now expire on January 11th at 12:01. Historically, what we've done is we have provided the public an awareness of what those orders are like. And again, we'll be following that same pattern this time. So we aren't here to speculate on orders. And when things are finalized, we will provide that to the public. In relation, I just want to add something here as well. Public health has been working long and hard throughout the pandemic to provide tools and utilize tools for the public and for different sectors to help mitigate issues related to COVID-19. We have education, we talk about the fundamentals, ongoing education about variants, how to prevent an infection from spreading, what a case is, what a contact is, how to manage oneself if they are a case or if they are a contact, what to do. We have public health orders, and we had different types of orders that we've changed to look at risk and how to mitigate risk. We've had masks, and and we keep talking about masks and the importance of masks, and getting a well-fitting mask is important as well. We have testing. We've deployed different types of testing based on supply, based on demand, and we're trying to do our best on that side as well to make sure Manitobans are able to access testing. We have treatments as well that we've incorporated along with the testing so that those who qualify can access a monoclonal antibody treatment. In the news, we're hearing about antivirals as well. And once Health Canada approves that and we have a supply coming into Manitoba, we're going to be operationalizing that as well. And that'll be coupled in with testing as well. So that planning is already there. The foundation for that is there. We have that message. If you're sick, it's important to stay at home. And we have vaccines, and we have had lots of discussions around vaccines. So there's a tremendous amount of tools here for people, for business leaders, for owners, for leaders to educate the public on, to utilize to help mitigate that risk of COVID-19. So we want people to continue, don't focus on one thing to prevent an infection. Let's focus on all the things that we have, all the tools that we have. There's no silver bullet here where one item works, where one tool works. All these tools work together to help mitigate the issues related to COVID-19 and to help prevent severe outcomes.
From CTV Winnipeg, Josh.
Good afternoon. A question for Dr. Reimer. You mentioned third doses or booster doses offer the best protection. We're seeing about 25% of eligible Manitobans have taken the chance to get that shot. Just wondering if you have any statistics similar to what the province shares on risk by vaccination based on no doses, 1 dose, or 2 doses, and what that might look like for people who are triple vaccinated.
Right now, most of the analyses that we have available in Manitoba compare people who have 2 or 3 doses to those who have 0 or 1 doses. And so that's the numbers that I can quote from Manitoba. But we have seen studies from many other places around the world that are showing that 2 doses is not very effective at preventing infection with Omicron, but remains very effective at preventing hospitalization and ICU admission, and that the booster really enhances that. What I am concerned about is the fact that when we look at the over 50 group, that at least half of them still have not received that 3rd dose. And these are the individuals who are at the highest risk of ending up in the hospital if they were to be infected. So, if you're over 50, I really do want to emphasize as much as possible that protection does decrease over time, especially the older you are. And so that booster becomes really important when you are older than 50, especially if you're over 70, and if you have health conditions that put you at high risk. Where you talk a lot about protecting the healthcare system, and that is really important, but we also want to protect every single Manitoban. Being in the hospital is a very unpleasant experience. Being in the ICU is a traumatic experience. And I don't want any Manitobans to experience an ICU admission. And so that's why we're really trying to encourage everybody over the age of 50, everybody who has health conditions that put them at risk. We want all of them to get the booster. And at this point, we really only seen about half of those higher risk folks getting that 3rd dose.
And I just wanted to check in to see if there's any sense or any evidence in Manitoba of Omicron leading to long COVID in people. I know we've heard a lot about more mild infections, less severe outcomes, but are we seeing any long-lasting cases here?
I think it's too early to tell in relation to Omicron and causing long COVID. I mean, it really just came here a few weeks ago. So I think only time will tell, and we'll have to wait and see as data is collected on that.
From CHVN, Taylor.
Hi, good afternoon. With those rapid tests, how confident are you that they're going to be accurate and, not give people false negatives thinking that they're okay and still going out in public?
So from a rapid antigen test perspective, if you're symptomatic, the rapid antigen tests are very good at picking up an infection. So, that's where we're utilizing those tests most specifically. We do use it. We have been using rapid tests for a long period of time, and we do use it for asymptomatic testing. Let's say for those who aren't vaccinated or are coming into workplaces that are public facing or healthcare workers, and that's sequential testing. So that's a little bit different than what we're doing on the testing side, the symptomatic side. So when you do sequential testing on asymptomatic individuals, the utilization of that or the effectiveness of that test isn't very good. But we wanted to protect the institution that the person works in. So catching even one case can protect the PCH. And that's why we utilized it in that manner, in that situation. In relation to if someone is symptomatic and they have a rapid test done and it's positive, we do assume that is positive, and it is very good correlation between a PCR positive and a rapid antigen positive. A rapid antigen test can be negative. And again, if you're symptomatic, you might still actually have COVID. That risk is small though, but we're still asking you to stay at home. We're still asking you to stay at home until your symptoms resolve, even though you may not have COVID. So again, when you're sick, you have a rapid antigen test. It doesn't mean you get to go out and do things. We're asking you to still stay at home. So I think that message has to be clear. I know some people have been using rapid antigen tests to have get-togethers. They want to make sure that everyone is negative on a rapid antigen test and come together, and that's a one-time use of a rapid antigen test. That is not a good utilization of that test and will miss a number of infections related to that. And that's why we don't recommend it and advise it in those situations as well.
Thanks. And one more, can you tell us about those Winnipeg Police Service cases? Would the province consider them in an outbreak? Is this like multiple clusters of cases?
I don't have the details on that. I just have the same information that you have related to the numbers. Our public health team would be working on that. I just don't have any background information on that at this point.
From the Winnipeg Free Press, Danielle.
Hi, Dr. Atwell. So with the move to rapid testing for the majority of Manitobans, and once this testing backlog, the PCR testing backlog is cleared, do you anticipate like an artificial decline in case counts, maybe over the next week or two? And just wondering how public health plans to prepare for hospitalizations without case data.
Well, we still have a backlog of over 6,000 cases, right? We're still going to be doing those PCR testings. We're transitioning to that rapid antigen test today as well. So we'll still have lots of PCR being done over the next 7 days' time. We still have a backlog to clear as well. So we'll have lots of information on case numbers. Afterwards, we still anticipate a lot of PCR testing being done because it is done in a number of different situations as well. So we'll have a good idea in general about case numbers. Again, this is going to be less about COVID cases in the future, and it'll be more of an impact on the acute care system. And again, there are other jurisdictions that are leading this as well. So we will learn from those jurisdictions as well. And we're going to continue to look at the best evidence we have to help the acute care system prepare. So we'll be providing them information in relation to that as well, so that they are ready. And we have been working with them all along on what to expect per se over the next week or 2 weeks or 3 weeks, and they are putting in measures to handle what is coming at them at this point, and we're going to continue to work with them as well to discuss that.
You talk about the best evidence for preparing for the acute system to prepare for COVID admissions. Just wondering if that includes wastewater monitoring.
So we have information related to wastewater monitoring related to COVID activity, and we do utilize that as well. So again, we look at a number of different data sources to look at risk and that potential risk for Manitobans, and what we recommend from a Manitoba standpoint related to everything that we do in public health. So we use every piece of information that we can get hands on to determine what is the best approach for Manitoba.
From Global News, Marnie.
Dr. Atwell, if kids are going back to school on the 17th, and we're likely going to see more cases, students, many of whom maybe only have one dose of a COVID-19 vaccine, are we considering changing the close contact rules, or are schools going to have to prepare for sending more kids home with work?
Yeah, so at the present time, I know we made that announcement yesterday. We're doing a lot of work with education. So we do have public health involved right now looking at contact management within the school setting. So there are meetings happening today in relation to that. And, again, when further information is available on that, once we finalize what we're going to do within schools regarding contact management and identifying contacts and providing those recommendations to schools, we'll provide that to the public as well. That work is being done as we speak.
Okay, thank you for that. And I think there's a lot of business owners right now that are kind of feeling somewhat in limbo as they're seeing what's happening with changes to schools. They're kind of wondering what they should be bracing for. I know you said you aren't going to speculate on the orders that will be changing next week, but what would you just want to say to those business owners to maybe give them some assurance or peace of mind?
I know government is working with leaders and representations from different businesses. So I think they have been meeting regularly from my understanding. So that some information is being shared there. Obviously, I don't think anything related to the orders is being shared. It's a challenging time for Manitoba. Very challenging time. It's a challenging time for not only Manitoba, for all the jurisdictions who have COVID impacting them, and now Omicron as well. And we're going to see Omicron, it is moving east to west. We're going to see greater case numbers on the western side as well, in Canada as well, and all through the world. So, I think what we need to really, again, focus in on is let's look at the tools that we have. We have lots of tools here related to how we manage and mitigate issues related to COVID-19. We have education, we have lots of material available, we have fundamentals, we have ideas on how businesses can operate, how people should interact. We look at distancing, look at how businesses operationalize, look at lunchrooms, staffing areas, try to separate individuals out. We have the orders, we have the orders. Yes, there's a lot of cases out there right now. It's very bad wintry conditions right now. I made this analogy before. The speed limit's 100, but we all slow down today when we're coming into work because it's icy. So let's slow down what we do from an orders perspective. Yes, the orders allow you to do X, Y, and Z, or let's cut what we are doing individually down. So if we're planning on interacting with 10 people this week, cut it down to 2 people. Let's do our part and know that the weather is bad. It's stormy outside, but let's do what we can to help mitigate issues, and don't just rely on the orders. Let's do a little bit more, and people have. Businesses have closed because they see what's happening as well for a short period of time. So we could all do something in relation to that. We have masks that are there. Let's make sure people are using masks properly. Use them anywhere in public places. Make sure people are coming into your storefront to wear that mask. If you're having people over, have them just keep that mask on. Everyone's got masks now, so let's utilize those masks. We have testing available. We're deploying a greater amount of testing, so let's utilize that testing and make sure, if you're sick, you're going to get tested. If you have a high-risk work environment, make sure you're able to access some testing to add that into your repertoire to make a safe workplace happen. We have treatment available as well. So if you do qualify for treatment and you're sick, go get tested and access that treatment. Again, the fundamental here is if you're sick, stay home and let people know, that you're sick, so that, the people who are around you can make some decisions about what they should be doing as well. Practice the fundamentals there. And again, if you're eligible for vaccine, get that first dose. If you got your first, get the second. If you qualify your third, get your third dose. So again, there's lots of tools there that everyone can utilize, whether you're an individual, as a family, as a community, as a business, that everyone can utilize to help mitigate the issues related to COVID-19.
From CTV National News Bureau in Winnipeg, Jill.
Dr. Atwal, I was speaking with chiefs yesterday, specifically the chief of Pimachikamak, who has a 90+% vaccination rate on his reserve and now 233 cases. How can you say Omicron hasn't spread to First Nations when the only testing happening is rapid tests?
So a lot of those samples that come from First Nations communities, they are also sent for PCR and sequencing as well. So even when we do rapid antigen tests and some of our PCRs as well, we're still doing that screening and we're still doing some sequencing. We're not doing all of them as well. But when things are related to a high risk environment, including First Nations communities, a lot of those are sent for PCR and a lot of those are sequenced as well. So, we are looking for it.
Okay, and then can you speak about reinfection then? How much reinfection are we seeing in the general population in Manitoba?
So we have some data on, so reinfection from after you've been vaccinated or reinfection from a previous COVID infection. I don't think we have data on reinfection from if you were naturally infected with COVID before, let's say a Delta or Alpha variant, and having an infection now with Omicron. I don't have data on that. We haven't looked at that data that I'm aware of. Obviously, there's infections that occur after vaccinations, and Dr. Reimer had discussed that as well.
Thank you, doctors. We have time for a few more questions. Media, please proceed.
Dr. Atwal, you talked about modeling yesterday, saying that it would be ready in about 24 hours, which is today. What does that modeling look like?
So we had just received some early modeling slides this morning, and our public health group is looking at it today. And I don't have any more updates on that at this point.
Dr. Atwal, you riled up some of your colleagues yesterday by saying that there is no crystal ball for COVID-19 when we know there is provincial modeling, federal modeling, the Doctors Manitoba projections, the warning letters from the doctors. Your colleagues are saying that we know enough from other jurisdictions like Quebec and that Manitoba isn't being proactive enough. Can you please respond to that criticism about your phrasing yesterday?
So in relation to what the exact impacts of Omicron will be on our acute care system, there will be an impact. The question is how much of an impact there would be. So when we look at data related to this from other jurisdictions, some of that data isn't clear cut, right? Some of that data shows that there might be no change at all in relation to hospitalizations, but is that very good data? So we're trying to look at very good data with populations that are similar to Manitoba's population to ascertain that risk. We're not saying the risk is zero. We're not saying it's less risk to the acute care system. We do understand I anticipate there'll be greater hospitalizations and greater ICUs related to COVID-19 and related to Omicron than our baseline, let's say, is right now. How much of an impact that has is the question mark. And we still have to really figure that out. And we're getting more information on a daily basis. Even from yesterday to today, we have more information. We're going to synthesize that information. So again, it is hard to predict that future, exactly to what extent it'll impact Manitoba. And a lot of it has to do with interactions as well, right? The more we interact, the more cases we will generate over a shorter period of time. And that'll have a greater impact in cases and severe outcomes in a shorter period of time. If we limit our interactions, even if you cut your interactions down by 50% or 75% with other individuals, that impact happens over a longer period of time. So yes, the system will be stressed, but it'll be stressed for a longer period of time, but won't have a large peak where the system is stressed. So again, there's a number of variables there. And a lot of it is dependent on how people interact, and a lot of it is on the science of it and how impactful Omicron is to an acute care system. So again, we're looking at that information every day. We're striving to get the best information possible and to make really good decisions for Manitoba.
Dr. Reimer.
Maybe just to elaborate a little bit more on cutting down your contacts, understandable. In that case, why not have some kind of like more heavy encouragement or even a mandate work from home for some sectors?
Again, everything's on the table. We've utilized different tools in the past, and we'll continue to think about what tools we want to use. And when recommendations are there and advice is there, we will provide that to the public. We do encourage people to work from home if you can. I think we've always said that, and we'll continue to say that.
Dr. Reimer, Josh from CTV here. The 25% of Manitobans who have received 3 doses, is that based on the number of people who are eligible today, or just the number of people who are eligible based on age?
I'm going to have to take that question back. I believe it's 25% of all Manitobans, but I don't want to give the wrong information to Manitobans. So we'll get that answer to you this afternoon. What I know is that for those people who are over the age of 50, that we're still only seeing about half of those individuals getting their 3rd dose. And so we really want to bring those numbers up. The older age groups do have a slightly higher uptake, but even there's a lot of people who still haven't gotten that 3rd dose. But we can get you a more fulsome data set this afternoon.
Dr. Atwell, it's Jill again from CTV. I'm just wondering about masking that you spoke about at the beginning of the press conference. Can you expand on that? Should we be changing our masking rules here in the province now, maybe not allowing any cloth masks?
So again, we do have recommendations there on the masking side. I don't think we're changing any rules or any recommendations for the masking. So we continue to talk about wearing a well-fitting mask. The type of mask really isn't too important depending on the setting that you might be working in. So again, if you're in a place where there's aerosol generating medical procedures occurring, that's where you want to use the N95. Outside of that, for most people, a 2-layer cloth mask with a filter that fits well, it would be good to use as well. I know there's a lot of talk about masks here, and people think, if you have this type of mask, you're going to prevent everything from happening. And that's just simply not true. Masks is one of the tools that we have to help mitigate the issues related to COVID-19. What's more important is having a mask that fits properly. You want to make sure it's comfortable. There's a seal. There's a nice covering of your nose, your mouth, and your chin. But you always want to make sure you're not touching it either. A mask almost is useless if you keep grabbing it and taking it off and putting it back on. If you don't wash it regularly, it doesn't help out then, right? So using a mask properly is probably much more important than the type of mask that most people are required to use. So that should be the emphasis. Again, there's no one silver bullet in this pandemic. We talked about all the tools again, right? We talked about education, orders, masks, testing, there's treatment options. If you're sick, stay at home, and we have vaccine available. So let's incorporate all of those things to mitigate that risk at an individual level, at a family level, at a community level, and a provincial level.
Dr. Atwell, do you have a sense today on the number of, or the number or percentage of healthcare workers that might be out sick or isolating?
I don't have that number, but perhaps our newsroom would be able to get that number for you from Shared Health.
Dr. Atwell, can you
go ahead.
Oh, thanks, Josh. I was just hoping you could elaborate on the likelihood that somebody would still be infectious with COVID-19 6 days after their symptoms first show up, if they are still showing symptoms, and what evidence Manitoba Public Health has used to shorten the isolation period in that case for healthcare workers.
So we have shortened that isolation period. Now, most people are most infectious 1 to 2 days prior to symptoms developing, and for the first 1 to 2 or maybe even 3 days after those symptoms develop. And what we've said is, as long as your symptoms are proving you're afebrile for 24 hours, that you could go back and go to a workplace setting like a healthcare setting as well after 5 days. But there, we're still requiring that use of a medical mask in that situation as well. And those things are in place. Now, the risk is never zero. Don't get me wrong. From a public health perspective, we know risk is there, but that risk is minimal in relation to risk to others to spread Omicron or to spread COVID-19 in that situation. So that's why we made that recommendation. And we also had issues related to staffing in certain sectors. And it's very impactful when people are off. So Omicron, it's a little bit different than Delta, where people are sicker quicker and they recover quicker and they're more infectious earlier in the stage of the illness than, let's say, a Delta variant as well. So that's why these changes were made to help people get back into those settings where their work is required, and to really mitigate some of the issues related to a lot of people being off for a longer period of time, and having those impacts in society and healthcare sectors or even other sectors as well.
Dr. Atwell, Josh from CTV here. I think you mentioned that it doesn't appear Omicron is spreading widely in Southern Health yet, just given the lower vaccine uptake in that health region. How concerned are you, and what message are you relaying to your colleagues on the acute care side about what to expect in terms of severe outcomes from people in that region?
So we all know it's going to be the dominant strain in Southern. It's going to get into the Northern Regional Health Authority. It's going to get into First Nations communities as well. So we've been very honest about that. I was just pointing out to what the data supports right now. We do expect those impacts to be felt if in the unvaccinated in the acute care system. And again, people are preparing the acute care system in relation to that. And that's why we've been messaging, and we're talking about all the things people can do to help prevent spread, to blunt that larger wave that we're in right now, to try to plateau that as quickly as possible and try to keep it plateaued for a longer period of time to lessen those impacts that'll happen rather than having in a shorter period of time, stretching it out so systems aren't overwhelmed right off the bat or early on. So again, that risk is there. It's going to happen where Omicron will become that dominant strain. And obviously, we'll see a greater number of cases generated where we see Omicron.
Time for a couple more.
Okay, just to edify again, you're saying we're dealing with a lot of variables when we're looking at data coming from other places. While it is encouraging, maybe if you could just reiterate some of the variables that Canada is facing, such as like our median age, our weather, our healthcare system.
I'm just going to let Dr. Reimer add into what I had said for the last question.
Yeah, I was actually back, I think it was Josh that was asking about the 25%. So I did just look that up. It's 25% of the whole population in Manitoba has received a third dose. If we're looking at the 18 plus, it's 31% of 18 plus have received a third dose. So just wanted to make sure that I believe it was Josh had that answer right away, but I'll hand back to Dr. Atwell for the variables question.
Sure. Can you just repeat the question so I just have it fresh in my head?
Oh, sorry. Just talking again about the data that's coming out of other jurisdictions like the UK and South Africa. You said, well, it's encouraging to see how Omicron is spreading and infection rates. You still said we have a lot of variables here in this country we have to consider. Maybe you could elaborate on a few things. I recall you had said about like our median age, our weather, maybe some issues we have in our healthcare.
So let's say we look at South Africa. Their median age is 14 years less ours. You know, in previous waves, they had a lot more infection that got distributed amongst the entire population compared to what occurred with Omicron as well. So all those things play into effect on severe outcomes. In the UK, they used mostly a different type of vaccine. You could argue some populations are the same. Their data that they collect, it is harder to look at from a hospitalization perspective and the impacts on hospitalizations in ICU. So work is being done on that right now. We have data from New York, let's say, or from Ontario and Quebec now that is showing an increased rise in ICU use related to COVID-19. The question is that because of Omicron or is that because of Delta? And, you know, we still have to tease some of that information out in those jurisdictions. The ICU data in most jurisdictions is fairly pure related to COVID-19. You know, so there's a number of variables there. When it's tough to make an apples and apples comparison because of those variables as well. So we are diligently working with you know, our partners here and you know, partners right across the country in public health to try to understand that. And nationally, they're working internationally to understand the risks related to Omicron as well. So we are all sharing information. And again, you know, once we have information, we will always provide that to the public.
Dr. Atwell, you mentioned yesterday the 5 to 6 days that people are waiting for PCR tests. Is that the median? And I mean, we're hearing people that are waiting longer than a week. What's the max? What's the minimum? Sort of how long have people been waiting for their results?
So I used, I mean, that was a number that I heard about, that people have been waiting multiple days. That wasn't the median or the mean. I don't know what that number is at the present time because there is a large backlog there. Our newsroom might be able to provide a minimum and a maximum related to that after talking to the testing task force that we could provide to the media.
You mentioned that 8 to 10 cases aren't even being reported for every one. You know, we had 1,700 cases today. That would mean, you know, 8,000, 9,000 a day. What does that tell you about the transmissibility of this variant?
Actually, that number would be close to like 16, 17,000, right? When you times it by 8. So that number is an estimate. We're not sure on that number 100%. And that's an estimate based on how infectious this is and what we were missing. We knew what we were missing before and applying a multiple to that as well. So again, we are seeing widespread illness related to COVID-19. There's thousands of cases being generated every day. We do understand that. And that's what other jurisdictions have seen as well. So again, we're learning and we're incorporating that into recommendations from a public health perspective. We're expanding testing. We shifted case and contact management because of that. The virus has changed. So all of our responses are changing in relation to how Omicron is impacting Manitoba. And again, a greater work will be done on that as well. I think we've done a lot of work related to this, and we're going to continue to look at the science, look at what's happening in Manitoba to provide the best guidance for Manitoba and the best strategies that we can utilize to mitigate issues related to COVID-19.
Thank you, doctors. Thank you, everyone. This concludes our Zoom session.